that intro of like, upgrade, downgrade. You heard it.
Check, check. That good?
Hi. Yeah, we have some seats up here, if anyone's still coming in. Do you guys all hear me back there? So I'm Josh Chapman. I'm the Chief Operating Officer here at Matter, and welcome for those of you who haven't been here before. I see a lot of familiar faces, so I know many of you have, but if not, Matter is where innovation happens in healthcare, and we do that by bringing together all parts of the ecosystem, specifically entrepreneurs, our large partners, which includes healthcare companies, payers, academia, and also being a community nexus and bringing together events like this where we can hear from some of the leaders in our space. So thank you all for coming this evening. We have a really great event. Before we start off, a couple items I wanted to call out. First, a big thanks to our partners, Jumpstart Ventures and Paragon Biosciences. They help us put on this event every month. We have another one coming up in a few weeks, so please come on back. I also want to point out that if you have questions during the event, those of you who are also online or here in the audience, we have social QA. There's a website up there behind me. Please feel free to hop on, post questions. You can upvote them, and then our moderator will be able to select the questions when we get to the Q&A portion of tonight's segment. All right, so tonight we have a really great company to talk about, which is Exicure. One of the hottest Chicago biotech companies over the last year. They've got a lot of press. And we're very fortunate to have David Giljohann here tonight, their CEO. He's going to talk about his journey as a lab assistant grad student all the way through to be the CEO of Exicure. And I'm very excited to have Arun Bhatia, our Senior Director of Programming here at Matter, one of the key people in our organization who's going to be moderating tonight's event. So please join me and give them a big welcome.
All right, good evening, everybody. How's everyone doing? Excellent. Welcome to Matter. And that's off to a good start, right?
Ready for the fire. So this is fireside chat.
This is we're going to get into the fire here really quick. Thanks to everybody for being here. This is really exciting. For those of you that know me, coming from the life science side, it's always really interesting to have life science folks come and talk about their journey. The last few tales that we've had have been interesting because we've had the guest and the moderator have actually been really close friends, like golfing buddies. They've known each other for 15, 20 years. I'd characterize David and mine interaction as sort of meeting again for the first time. As we were prepping for this, me more so than him, I actually realized we met about 7 years ago, back when I was at Baxter Ventures and we were actually looking at Orisense as an investment. And we were doing our due diligence, and I had met David a couple times along with the team there as we were learning a little bit more about the company. So I'm thrilled to see how far he personally has come and how far the company has come. And we'll learn a little bit more about that tonight. I'm also really excited because we often don't hear, for those of you that are in the life sciences space, we often don't hear a lot about sort of scientific founders from companies, especially in the life sciences, move in the trajectory that David has moved. Oftentimes they move into advisory roles as the company gets bigger and the management team changes. David's kind of done the opposite. He sort of flipped and moved into the CEO role in a number of steps, which is really, really interesting and really intriguing, and hopefully we'll learn a little bit more tonight about how he did that. So welcome. Thank you for being here.
It's nice to be here.
Let's start, as we typically do, with a little bit of your background. Let's get to know who you are. We had talked about understanding a little bit of his early days before he came to Chicago. So start us off a little bit about your background and maybe just a snippet of the company and what you're doing today, and then we'll circle back and talk a little bit more about that.
Sure. So the origin story where I get bit by a spider and then...
Yeah.
Actually, I probably did get bit by a lot of spiders along the way. In terms of my personal interest in becoming a scientist and what brought me here from the early days is I've always really been interested in biology and the natural world. And I was the kid growing up who was mucking around in the pond, catching fish and frogs and taking them home to my siblings and especially my sister's great delight, a lot of times ending up in the wrong spots. Yeah, I've always been interested in science and ended up going to Northwestern and pursuing a degree in biology and worked in a lab as an undergraduate, circadian rhythms research, so studying sleep-wake cycles. That what really got me into the R&D kind of mode as an early student. So fast forwarding from there, ended up staying at Northwestern, so these days bleed plenty purple. And did a PhD in chemistry or chemistry lab, Chad Mirkin's group at Northwestern, and so have been here in the Chicago area now for quite some time, and have enjoyed building a company which these days is called Exicure, and it's a Chicago-based company. We're right up the road in Skokie, and we can tell you a little bit about what we do at Exicure. Exicure's genesis was actually my PhD work with Chad Mirkin in his laboratory, and we took that technology called spherical nucleic acid, which are arrangements of DNA or RNA in nanoparticle format. We took those structures out of the laboratory at Northwestern, and we turned it into what today has become Exicure. Exicure is a clinical stage company. We're publicly traded on the exchanges, so you can look it up. That's a fun story we can tell, I'm sure, tonight. And we've got several drugs in clinical trials. And for me, that's been one of the most exciting parts about the story is taking something all the way from napkin sketch in Northwestern laboratory all the way to today, where right now patients are being treated with our Exicure technology. So it's been really fun to follow that as a scientist and as a entrepreneur along the way.
Yeah. The start of that journey, you mentioned you grew up in Wisconsin. I always find it interesting to talk to people about, interesting childhood moments, things that may have happened to you that really set you on a path or shaped your perspectives on certain things, especially as you got interested in science. Curious if you had any such relevant moments in your childhood.
I feel like we should get on a couch or something. Way back. Well, it was once. So let's see. I think the time in which I was growing up and starting to really understand science and things that were going on, the context was one where we were just starting to understand genetics and the human genome. And kind of the time between I was a high school student and then becoming an undergraduate researcher is when we were sequencing the human genome. And so you had all this real great excitement around this idea that the fundamental understanding of life, the A's, G's, T's, and C's that underlie DNA, could actually really be understood. So I think that kind of firmament as I was becoming a grown boy in the laboratory was really formative for me and got me interested in doing genetic medicine, which is how I've now spent my career.
Great. And many of us, I think there are folks in the audience who are either PhDs or postdocs, work in the lab. I also worked in the lab. I'm curious about your experience as you started college, you started working in the lab, what some of your early impressions were. What did you do? And what were some of your early impressions of research life and academic life?
Yeah, it was super sexy. I started washing dishes in the laboratory as most good biology students do, right?
Yeah.
Actually, that's how I spent the first couple of years. And I think it's actually a great spot to start early in your career, at the bottom of the totem pole in the laboratory, because you kind of see what it's like to be a researcher. First impressions is, wow, this is super boring, right? So you watch people do things over and over and over again, repeat, and a lot of times not being successful. So I think seeing that, but ultimately realizing that all of those failures and struggles along the way resulted in exciting, successful outcomes for a lot of experiments. really set the stage for me to understand the research process. The commitment that it takes, understanding the long journey that it takes from idea all the way to having execution and some type of reportable result. And so that was, I think, a great foundational experience for me in the laboratory. I went from washing the dishes to starting to help with experiments along the way. They put me into pouring gels in the lab. That's the next, for those of you who are biology students, that's the next big step up the ladder, right? So now you get to, you're not washing dishes anymore. You got somebody else do that for you. You're gonna pour gels. And in this case, we were using radio-labeled gels, so we're using polyacrylamide and things as well. So I think the reason they put the young students in there as well is just a risk mitigation thing, right?
Sure.
So give the young guy the radioactive stuff. Yeah, so that was fun for us. Those were DNA sequencing gels that we were running at that time. And then ultimately, sometime along the way, started running my own experiments, which was a really compelling experience for me. I worked with a guy at Northwestern who was doing the circadian rhythms research named Joe Takahashi. And to Joe's great credit, not a person who spent a lot of time in the lab himself, but a great PI, because he mentored really well the postdocs, the graduate students, and then also even the undergraduates. He let them do their very own experiments. And I'm sure that I wasted lots of his R&D dollars along the way, but ultimately I think hopefully they were well spent, because it set me on a career and an exciting trajectory, I think, for science in general. So very grateful for that experience in the laboratory as I was maturing as a scientist.
And this was around end of 1999. You started college, right?
That's right.
Did you, at that time, so this was before, I would say, entrepreneurship became, the really sexy buzzword. As you looked around, as you were doing research in the lab, did you see a lot of PIs, principal investigators in the lab, who were interested in entrepreneurship, were interested in starting their companies? I
had no idea it existed at the time. In fact, I probably became an entrepreneur myself and started the company before I realized that was a cool thing to do. It was the pathway that I saw from the early days was that after the washing dishes and the running experiments yourself was you became a grad student, and then from a grad student you became a postdoc, and then from postdoc you became an assistant professor, and maybe if you're lucky one day you could become a professor. So that was the trajectory and the pathway that I saw from early on. I was always looking towards that as a career. I never was the undergrad who was doing biology research because they wanted to look better on their med school application. That was not me. I didn't like sick people, so I was trying to stay away from that, but I really liked the science. In fact, I think I was the only undergraduate at Northwestern that time that was a biology major and was not a pre-med. So I was like this odd duck that wanted to do research but really had no intentions of going to medical school. But yeah, I think that's the trajectory people saw. They were either into research because they were heading to medical school, or they were in research because they thought they were going to do academic research. And that was the two tracks that were laid out. Pharma was a big mystery for me. I remember as an undergraduate, there was this company up the road called Abbott, and Abbott offered some summer internships at some point, but I was like, I have no idea really what that's about. And really had no idea what the pharma world was. Even as a grad student, I think that for a lot of grad students and postdocs, that pharma world remains somewhat of a mystery. Hopefully that's changing now these days. But in terms of entrepreneurship and starting a business, I think that's a rarity. When I got to graduate school, I was very fortunate that I ended up in Chad Mirkin's group. Chad had started companies previously, so there had definitely been some experience there on his end in terms of starting companies and growing them. And I think that as a result, when I was in his laboratory, I saw that as a potential outlet for some of the science that we were doing. It wasn't all this heady writing papers and trying to get published in Science and Nature and all those other journals, but you could actually look for real-world applications of your technology. And I think that definitely being in Chad's lab set the stage for me to understand that you could take your PhD or graduate studies work and turn it into something that was applicable, outside the hallowed halls of academia.
Yeah. And so I assume at this point, as you're making that transition from college to postdoc, or college to PhD, Any exposure on the business side as far as whether you're talking to folks who work on the business side of biotech or taking any classes or learning a little bit about the business side? Did you have any of that?
So there was Kellogg, which was right next door while we were in graduate school, and we were always, I don't know, envious or one of the Kellogg students, but those were party MBAs, as we were all joke around in graduate school. That they weren't doing real work. We were all in the laboratory slaving away, and they were busy out there having their social events on the quad. So that was my exposure to the business world. Looked like a lot of fun, so I decided that's where I should go. No, it was definitely helpful to be in an environment at Northwestern where there was an opportunity to be exposed to some of the business side of things as well. I did take a course as a graduate student that was called Business for Scientists, which was this really big, thick binder, and we went through it in about 2 weeks over at Kellogg, and actually found that binder recently, several months ago. And I looked back through it, and I was like, wow, I really didn't understand any of this at the time when I did it. There's these equations on there about market size, and there's stuff about Sarbanes-Oxley compliance for public companies. And at the time, I'm sure I passed the tests, but I had no idea conceptually what all these things were. But it definitely was some nice exposure to the idea that there's this whole business side to science that most people in their undergraduate or graduate careers don't see. And so I think the fact that I was exposed to that, definitely led me to understand that was an important part of the equation when it came to looking at science and technology.
Yeah. And as you started working in Chad's lab and doing your experiments, curious about when the seeds of sort of entrepreneurship started forming for you personally, maybe for Chad himself, who was a sort of seasoned entrepreneur, but for you personally, when did it start to dawn on you that, okay, being in academia, being at the lab for the rest of my life, that's one path, but maybe there's another path here that I should explore?
Yeah. I don't know that there was any aha moment. I think what happened is a little bit just an evolution. So as I was finishing up my graduate school work, I obviously really thought that the things that we were doing were cool. Of course, I was biased. But ultimately, I was like, this is real world applicable. How are we going to get this technology out of my PhD thesis and out into applications? And so as a result, I realized that it was too nascent of a technology to license off to some big pharma company. Abbott or Baxter wasn't going to walk in and say, oh, this is really cool academic research that you did, David. We read your thesis because that's what we do at the pharma companies is we sit around and read thesis and we're going to go ahead and commercialize your technology. So I think it was more of, I really think this technology could make it out in the real environment out there. I think that it could actually help patients. It could actually be used therapeutically and for different diagnostic purposes. And so ultimately what I think I ended up doing was starting the company and just naturally evolved to by necessity, right? So somebody needed to do it, so why not me? Right?
Yeah. When we were doing due diligence, I did read your thesis, by the way.
You did?
No, I didn't.
Oh, see,
I didn't at all. I'm lying.
See, the part Arun left out about us meeting again for the first time is that when we were doing investment back in the company in the early days, and he was at Baxter Ventures, he said no to investing in the company.
That's not true.
It wasn't
not
you?
true. It wasn't me. It was not me. At least not that I'm going to admit up here.
Yeah.
So outside of the thought of, hey, there's real world application to the technology, again, just paint a picture for us in terms of, what did you think entrepreneurship, sort of being entrepreneurial meant, being an entrepreneur? What was your perception of it at that time?
Yeah. Well, it was definitely before the days where it was cool to be an entrepreneur and everybody knew about, San Francisco and Boston biotech and, there was no TV shows about it for sure. For me, entrepreneurship was more about just doing what needed to get done. So taking a look at the problems that needed to be solved and going out and doing it. So I didn't really have any model per se. in my head about what an entrepreneur was. I just knew that entrepreneurs were the guys that rolled up their sleeves and tried to build something. I think the PhD training that I did actually prepared really well for that kind of mindset. When you're doing your graduate work and you're running experiments, all the way from back in the laboratory, you're realizing that you're having to roll up your sleeves and do the work, and things are going to be successful and things aren't going to be successful, and nobody's really guiding you, step by step along the way. I think that's really good training for being an entrepreneur. You have all these different kind of pieces, and you've got resources at your disposal as you're going along, and you fight for resources just like you do when you're in your graduate school. But ultimately, you got to put those pieces together, yourself, and trying to figure out how those pieces come together in order to advance something. And so, literally, I think it was just, okay, what's the next step, and what's the next step after that? And as we started to build the company, and that's the process that we did. There was definitely a lot of naivete in the early days about what it would take to start a therapeutics company. At transition point, people are like, okay, so at what point did you start the company? And, there was no big, ceremony and confetti flying down and showing up at some beautiful lab space where, you walk in and your research staff is just ready to go to work on making your therapeutic drugs. Starting a company actually is really, really difficult. And luckily, Northwestern was there as kind of a resource along the way to help. But as I described it to somebody, so you want to start a company, and let's say you even have some cash from some investors that want to invest in your business plan and your idea that you came up with. Great. So now you take that cash and you rent an office space. And the first thing that you need to do is you need to make some phone calls, and you're going to start buying laboratory equipment and all these kind of things. Well, how do you set up a phone line from the office space when you've got a checkbook but you don't have any credit? The first thing that happens when you call a phone company is they want to know what credit card you're going to secure this with, and you say, well, we don't have a company credit card because our company has no credit. What's in the back pocket? I think actually the first 2 years of the company, I had about $50,000 worth of debt continually on my credit card. Just because that's how it built credit as an early company.
And was it just you in the company? Who else was on this?
Well, I was employee number one, and so that's where we started. And it was definitely my credit card. I don't know where Chad was with his credit card, but it was in the office. So then you got the phone line, right? So then the next problem is we want to start running some experiments, and you say, well, to do that, we need some chemicals in order to run some experiments. So I got the phone line, and you call up Sigma Aldrich, and you say, hi, Sigma, my name is David, and I would like to buy some potassium chloride. Would you please ship it to this address? And Sigma says, I'm sorry, who the heck are you? We're not shipping you chemicals, right? So that was a huge challenge, right? So in the university environment, you completely take that for granted. When you show up, you place an order, somebody in the order placement department is going to go ahead and get that order done. It shows up, shipping and receiving unpacks it, they take the MSDS, they put it in a binder, and it shows up on your laboratory bench. Well, none of that happens automatically when you're starting a company, and Sigma doesn't really just want to ship you chemicals, right? So anyway, that was this step-by-step process along the way is literally trying to think a step ahead, but it's not like there's some grand our overarching plan and magical environment that you walk into where starting a business is easy to do.
Yeah. Growing pains early on that you probably don't think about as you're starting a company. Sort of fast forward a little bit and zoom out. So you're sort of this army of one building this company. At some point, you get to a place where you're trying to tell your story, not only about the science but about the business, to investors and to maybe strategics or partners, whoever it might be. One of the challenges I think we see not only in our ecosystem but every ecosystem is, as a scientist, how do you learn to tell a good story? That's not the thesis, but that's sort of the 30-second or the minute pitch to get somebody interested. How did you address that? What was your style telling?
Yeah, so it's definitely almost kind of like learning another language along the way. So you come out and you've got this really fantastic science, and that's actually really, really complicated, to anybody besides you. And you think you're going to explain it to somebody on the outside, and it's actually incredibly impossible to do, right? So I was trying to think, this is taking me way back, but thesis was titled Polyvalent Oligonucleotide Nanoparticle Conjugates.
Of course.
Right?
Yeah.
So I try saying that 3 times to an investor and then asking them if they want to invest, right? So there's an element of marketing that had to come with it. So it was finally simplified to spherical nucleic acids. Maybe still complicated to some that are outside the field, but it was a lot easier than that tongue twister that was the PhD thesis. So you have to be able to translate it to your audience at the right level. And you also have to realize that all the cool science and all of the cool stuff that you did along the way is going to be distilled down into very, very simple messages. And that is a hard thing to learn how to do for a lot of people, but definitely very necessary when you're trying to build some investor interest and even trying to get people to join your company. Right? So you're going to recruit people into your new company and try to explain to them what you're doing. If you can't explain to them very simply what it is that you're trying to achieve at the company, I think it's very difficult, to hire people and talent to run it. So there's definitely a learning curve as you learn from speaking the scientific language to speaking a language that can be understood by others. So that was a challenge in the early days, for sure.
Yeah. I've always found it amazing when you ask someone that's worked in academia for 30 years, and not only academia for 30 years, but they focused on one protein of interest for 30 years, distill down all your work into a 30-second pitch or an elevator pitch. It's a very, very hard thing to do.
Yeah.
But an important skill set as you're growing a company.
It is. The other thing that's really interesting, if I look back at some of the early presentations that we gave at the company, it's always fun to do, right? A retrospective look about, what you're doing right and wrong. Most cases incorrectly in terms of investor discussions. But you're coming from this mindset about I'm going to show a whole bunch of data, right? So I'm going to put a whole bunch of data on the slide. And I'm looking at these figures and I'm trying to reinterpret here 5 years later what these figures meant. And I was thinking, what the heck was I doing trying to show this to an investor? There are so many lines going everywhere on this chart. How did they possibly understand what I was talking about? So I think, definitely the thinking is, there's so much cool stuff here. I'm going to show everything, and I'm going to make a big figure on my slide that's something that came out of a Nature article, right? But ultimately, you need very simple, clear messages. Things go up, things go down. Animal has tumor, animal doesn't have tumor. These types of messages, and how you get there along the way are secondary messages, or maybe they're for a second or third deeper dive with somebody in the outside world, but not your high level, thing that you're trying to communicate.
Well, and the other big challenging thing, and we have a number of, again, life science entrepreneurs in the room who are sitting here today thinking, I've got limited resources, obviously limited funds, limited time. There are 15, 20, 30, 50 things that I could go do, different studies I could go do, places where I can invest my assets, my time. Impossible question to answer sort of in one way, but how did you think about, as you started growing the company, separating out interesting science and interesting science studies from those that are really going to impact product development?
Yeah. So that's a constant struggle. It still is, because I'm a scientist at heart. And of course, now I'm leading a public company. And so the tension between the two is actually acute, right? So there's a lot of cool experiments that I want to do, but I'm always juggling that with the idea about, is anybody actually going to care? Is this going to move the needle in terms of our development or the outside world? I think the great thing for our company is that we're a science-based company, and so the science starts at the top, and everybody at the company is understanding that we're a science-driven company. And as a result of that, credibility that I bring as a scientist to the leadership role, I can look at really cool experiments that people are proposing to do and say, yes, I'm a scientist too, and I understand why that's really cool, and yes, I really want to know the answer as well. But I'd rather spend that $750,000 on something else because, in terms of our company trajectory, it's much more important. So while those things are really important questions to answer, or a really cool piece of science, and I'd really love to understand it, I have to think about where the resources go. So that balance is a tough one to strike, and it always pulls me a little bit. I'm always leaning towards let's understand the science and the fundamentals. I think ultimately, long term, that's an awesome thing, and that's the way that things should be. If you understand the basics, that's great. But oftentimes, you're left with the hard choice about where the resource goes, and science doesn't always win.
Right.
So,
talk a little bit about fast forwarding into the development of the company before you went public. But talk about this transition that we alluded to in the beginning. So you started off as a co-founder. Were you the chief scientific officer of the company?
the research is called founding scientist.
Founding scientist.
Yep.
And talk about your trajectory from there in terms of from a time perspective and what that next position was that you went to.
Yeah. So, well, day one, I guess title isn't really that important, right? You're everything. You're chief coffee maker and and you're shipping and receiving, right? So,
Right.
But as the company grew, always on the lookout for great talent, but maybe since this is Tales from the Trenches, we can say everything has been a field promotion, right? So you get promoted up the ranks as you go. So in the early days, I was a scientist and was doing science in the laboratory, and then eventually there's a bunch more scientists, and I'm leading the scientists, and at some point became chief scientific officer. And then we moved from doing science to also doing a whole bunch of this business stuff, which at the time was something that scientists don't do, right? But there's this whole business thing. So then we had a whole bunch of business people there. And so then there's somebody who needs to lead the business and the science. And so then I became chief operating officer. And then, you grow and you bring in a whole bunch more people in order to grow the business, and you do this whole financing thing. And then somebody needs to lead the finance and the business and the science. And so now you get, moved up to being CEO. So along the way, I think, I learned a lot in each of the positions, and definitely was, moving in that direction. But if you would have asked me, 5 years ago, are you planning on being the CEO of this company? I would have said, no, of course not. Like, you need to bring in a CEO, somebody who knows what they're doing, right? That's I wouldn't know what I was doing. But, along the way, I think, step by step, piece by piece, built that, knowledge base, and was ultimately able to progress to become the CEO.
And as you're in that process, I'm sure you're bringing in folks who are operational folks, finance folks. What are they thinking when they're coming in and saying, okay, I'm being led by a scientific guy. What did you learn in that process in terms of working with different types of people and leading them?
Yeah, I don't know what they're thinking, right? So finding the right people to hire into that environment is definitely been a challenge along the way. So you'll definitely find people who won't want to work in a startup environment. Startup environment means a lot of things to a lot of different people, but a lot of people that come in that are mature in their career are looking for some structure. Some of that structure doesn't exist in a startup company, and oftentimes I think people try to build it along the way. I think the other challenge is that not only being a scientist, but also being a young guy and trying to recruit in some of that maturity into the company. So guys with the gray hair that know what they're doing when it comes to filing quarterly reports with the SEC, something that I would never do. There's got to be some common vision in terms of where the company is going, and they're buying not only into you and your leadership style, but they're also buying into the vision for the company. So setting out that vision for where you want the company to go, and getting people to buy into not only working with you and your team, but that vision, I think, is really important as you start to build your team.
And we had a roundtable right before this with some folks. I was hoping you could share this story, because I think it's really interesting as you talk about telling your story, and not only telling your story, but how you thought about getting into market and what your strategy and what your vision is. You had mentioned a little bit about marrying cool science with novel clinical pathways and the learnings that you took from that. I'm hoping you could share that story with the audience as well.
Sure, yeah. So the story I shared in the roundtable was one about how we had really cool science, and we also thought we had really cool places where we could develop the science clinically, both of which were in the outside world, their minds was unknown, right? So unproven technology, unknown clinical path, unknown market, unknown path to commercialization, unknown ability for payers and insurers and things to reimburse. And so one of the challenges, I think, that was in the early days was to get people to make those leaps of faith, if you will, from place to place. So if I believe this is a really cool technology, do I also believe that there's a really cool application in this clinical trial that has never been done before? And do I also believe that there's going to be a market there? And do I also believe people are going to want it? And not only want it, but are people going to, the insurance side, going to reimburse it? Right. So I think one of the things we did in the early days is we set out really cool science plus really cool applications, and it was hard for people to make all of those leaps of logic. Interestingly enough, all those programs that we started back in the early days still exist at Exicure, and we're still pursuing them successfully right now in the clinic. But along the way, about a year or so ago, what we realized is that we needed to paint a clearer picture for people of stepping stones to success along the way. So we undertook a program last year in spinal muscular atrophy. And spinal muscular atrophy basically is a disease and affects children. It has to do with mobility and paralysis, and it's devastating and oftentimes fatal for kids. The competitors in the space of nucleic acid therapeutics had developed a molecule all the way out through clinical approval called Spinraza, currently commercially sold by Biogen. But Biogen and their partner Ionis along the way had made each of those transitions. So they had shown really cool technology back in the 90s. Then they progressed it up and basically made it all the way up to the point where Biogen was selling the drug. It was being injected into kids, and you could see an improvement in the kids. Biogen was making money off of it, and the kids had the first option for a drug for something which was previously completely untreatable. So what we did at Exicure was we basically said, let's take a learning from that, and let's paint that picture for investors and for others on the outside world, and show them how the Exicure technology can make a huge difference in the context of a story that they can understand from start to finish. So at the end of June, we basically published for the first time results showing that you take DNA or RNA, Biogen's molecule, and you can put it in our 3D spherical nucleic acid platform using the Exicure technology. And sure enough, we saw this leap and improvement dramatic in the mouse models, that when you created the 3D structure, which we've been telling people all along, was incredible in terms of its ability to get into cells, incredible in terms of potency for all these cool indications. Now we basically said, here's an indication that you understand, here's how the Exicure technology benchmarks against somebody else in the space, and there's a very clear path all the way to the finish line. So for us, that was, I think, a watershed moment, because now that people understood, here's the Exicure technology, and here's a pathway for it to be successful all the way commercially. There's not only a great story there for patients, but I can also understand if Exicure showed they're better with this piece of technology, that we're going to give credibility to all of their other stories that they've been telling us so far, which don't have that line all the way to the finish, but now it's much clearer for me to see that there's an ability to get there.
And it's almost sort of two birds with one stone. One is you're proving out your business model a little bit, and the second is, at this time, and for those of folks that may not know, the oligonucleotide therapy approach was littered with a lot of failures in that space. So I'm sure investors were looking at this and saying, how are you different than all the other ones that came before you? So this approach seemed to really help tell that story.
Yep. We were also not only facing, I think, an uphill battle for the nucleic acid space, but we're also finding a perception that all nucleic acids had to be delivered to the liver. And if you look at the space, still 90% of the drugs that are being developed for nucleic acid-based therapeutics are based upon liver disease. The name of our company, Exicure, X being outside and ICUR being liver in Latin, we were basically telling everybody, we're not going to follow everybody else in the liver. We're going to do all this cool science with our spherical nucleic acid, and we're going to do it outside the liver. So we're going to do lung and eye and GI tract and skin, and we're going to do oncology and all these places nucleic acids had never gone before. So it definitely took some believers to come into the story to understand that we had really opened up entire new opportunities for therapeutic areas and organs and tissues of interest that previously hadn't existed for this whole nucleic acid space.
Mm-hmm. So talk a little bit now about that transition from, it was Orasense, now you've transitioned to Exicure, you're the CEO of the company. Take us into the conversations around going public. What were some of the pros and cons to that? What triggered that conversation, and how are you guys thinking about that internally?
Sure. So as the company grows and we continue to progress drugs into clinical trials, we have 3 now that are at clinical stage, the need for capital grows. And you can't do it purely using angel investors and private funds. And so one of the things that we're looking for was how to expand our investor base and have better access to capital. Simultaneously, we realized in order to do that, you need better exposure to capital markets. And by exposure to capital markets, that means that you need to essentially go public. So that was the big consideration. I think the great thing for Exicure is the path that we chose allowed us to mature the technology in the early days outside the spotlight of an early IPO on Wall Street. And that allowed us to work out a lot of the kinks and a lot of the nuances of the technology before we ever launched into clinical trials without that kind of pressure and eye on top of you. So we decided that the time was right, the technology was mature enough, and the need was there for us to raise capital. So we decided the best way to do that was to undertake a public offering. So we did this actually through a reverse merger. So for those that are interested, what we did is we bought a shell, and the shell had a public ticker. That shell had nothing in it, so it was clean, no assets, no liabilities. But by assuming and essentially reverse merging into the public entity, XCUR became public. And that allowed us now to have a ticker. So XCUR, you can look it up, and this is what investors do. They can follow the stock. We're filing, our P's and our Q's, as we call it, so our quarterly reports, so people can actually read those and see how we're progressing as a company. We put out press releases, and the press releases appear on Yahoo Finance, right? And you get your Google alerts and all those kind of things. And really, for us, that meant that now we have increased exposure. So outside of the Chicago area and outside of our, smaller investor base, we're now on a public scene. That not only means that you're on Yahoo and everything else, I mean, it's not like magically overnight everybody knows who you are. There's still a lot of hand-to-hand combat, so I'm back and forth on a plane to New York all the time talking to investors, trying to increase Exicure's exposure to the outside world. As a public company, we now go to a lot of banking and investing conferences. The bankers and investors who have these things called investors, who are their clients, are trying to match up cool stories in the biotech space with their investor clientele. And so, we're talking to, investors now mediated by banks and other institutions that are trying to serve as matchmakers for those different pieces of the puzzle. So, that's the big pro for us. The con, of course, is now that you have to do all those P's and Q's and everything along the way, you're accountable to people along the way who are watching your moves. And so setting out long-term strategy and things, is in telling a story, out 5 years from now is more difficult than trying to tell the one about what's happening next quarter and what's happening next year. So it's definitely a challenge for us to set long-term vision through some of those steps. It's a challenge. We do it. We're definitely setting a long-term vision, but there's a lot more focus on some of the near-term, which comes with being a public company. And then, of course, there's the stock price, right? So I don't look at it minute by minute, but lots of people are hitting refresh all the time. And when it goes up, they ask me why it goes up, and when it goes down, they ask me why it goes down. And the flip answer, of course, is there's more sellers than buyers, or there's more buyers than sellers, right? That's a lot of the time the best answer that I've got. So, it's not like something fundamentally shifted at the company on an hour-by-hour basis. But that's the kind of scrutiny and things that people have now for us, and far too many people have my cell phone number, so that's.
So you talked about how that process has certainly brought you more visibility. Cycle back to when you made that decision. If this was a company that was based in Boston or San Francisco, do you think you'd be making the same decision?
Yeah, I think the way we built the company is actually, was really well done. I definitely think that the path that we set out on is a different one than others have gone about before. And had we started the company in Cambridge, Massachusetts, or had we gone out and started in San Francisco, I think our path and the way we would have done it might have been different. However, given the way that we started the company, I think the way we did it was actually pretty intelligent in terms of allowing the technology to mature outside of kind of that firmament and spotlight that occurs in both of those hubs for biotech.
Do you get, as you talk to investors now versus when you talk to them, private investors before, do you get pushback now to say, hey, David, great job. We know you're the scientist. I know you get the CEO title. Do they still look at it and say, okay, but when are you going to hire a CEO? Does that ever happen?
That's my face. Maybe they do it afterwards, after I leave. I've always said that if there's somebody else that comes along that's going to drive it with as much passion and energy as I'm willing to put behind it, then great. But really the CEO role is not that complicated. How I look at it is just bringing resources to bear upon a story. So resources means the right people, the right investors, the right capital, and hiring the right people. We've got a fantastic team of people on the financial side. We have a chief financial officer that came out of several public companies, a chief scientific officer that came out of a public company. Our chief operating officer that we hired this year ran a public company in Europe. So there's definitely maturity in the company, and what I bring to it, I think, is the 24/7 drive and passion to marshal that force to bring the XCUR drugs out into patients.
Yeah. And this conversation always leads, when we talk about life sciences in Chicago and the Midwest, and we talk about ourselves as an ecosystem. Undoubtedly, you've gotten the question of, are you going to stay in Chicago or are you going to move? I'm sure investors are pushing you to probably move. What's your thinking around sort of the advantages of this ecosystem, even some of the disadvantages, things that maybe there's some key gaps here that we should be thinking about? How have you reconciled that?
Yeah, sure. So I think, that's one of the most common investor questions that I get. So they look at the business card and they say, Skokie, Illinois. And I say, oh, it's Chicago. And then they say, Chicago? There's biotech in Chicago? And yes, there's biotech in Chicago. A lot of people don't look at it that way. So then they ask the obvious question, which is, well, why haven't you guys moved to Boston? And the answer is, well, there's a fantastic resource here in the Midwest. There's hospitals and universities and access to talent and everything. And by the way, dear investor, if I'm going to put your money to work, it's a heck of a lot cheaper to run a business in Chicago than it is to run it out of San Francisco, right? And so I think from my seat, I definitely need to be in those interacting with those ecosystems. So I'm out to Boston and San Francisco and New York constantly. But in terms of actually building the company and the fundamentals behind building a company, all the right components are here in the Chicago area. I don't think that there's anything lacking for the content to be built for the organizations. Some challenges that we face, the personal one for me is that I'm constantly going to try to make those connections, on either of the coasts. But by the way, being in the middle of the country, that actually works to our benefit because O'Hare goes both ways. I can fly either San Francisco or Boston tonight. There is a challenge in terms of space in Chicago. We have lots of open space, unlike folks that are dealing with things in Boston right now. But there's not walk-in ready space for a small company that's looking to start. So wet lab space, for scientific stories is actually really hard to come by. We're up at the Science and Technology Park in Skokie. It was the ex-GD Searle site. And we're really lucky that we have that resource up there, and it's full. And so if you're a new company looking to start, I think the challenge is where do you find the incubator space that you need to get your feet on the ground. You don't have the resources to do it yourself. So I think that is one thing that we're really lacking here in the Chicago area. I know I saw an announcement recently that Rosalind Franklin is building an incubator space. I think that's going to be really interesting to see who they're able to attract then to the area, and hopefully some of that space constraint allows you to move forward. There's always the critical mass question about is there critical mass in Chicago for biotech, and I never really understood what that really means. I think that there of course is critical mass. I mean, look around in the room. There's tons of people that are involved in tech and biotech and things here in the Chicago. Now I can say, this is at least not Iowa, right? So it's the same way the people in Boston say about us. But no, the resources and everything are here that you need to do it. And it's a benefit for us building the company. It's also, I think, a huge benefit for the employees. So all the people that are involved in the company, the cost of living here in Chicago land area, the access to the school system, those types of things, quality of life issues, I think are really fantastic for people to be attracted to work at companies in the Chicago area.
Yeah. So just as a reminder, matter.socialqa.com if you have some questions to put through. I'll start going to some of those in a second. Again, just from our roundtable discussion before, so how many flights did you say you've been on in the last year?
So at a point of pride, last year I got on and off an American Airlines plane 128 times. So the running joke. Is that an American Airlines person? Yeah. Because I feel like I could be on a commercial. Oops.
That's right. And the part that maybe made me a little sad is describe the Chicago discount. That you heard from investors. What does that mean?
Yeah. So oftentimes when people look at the company, they say they apply what's called the Chicago discount, or we are getting what's called the Chicago discount. I don't think that should be a thing. I think that ultimately the value of the company is in the drugs that we develop. But it does require that I get on and off a plane a lot. So the running joke is when people ask you, well, where are you from? I don't say Chicago. I say I'm from seat 7A on American Airlines because that's where I live. But I think as long as the management and the company is really willing to be involved in those ecosystems that exist elsewhere, there's really no downside to having the company based out of Chicago, because ultimately, things like valuations of the company, access to some of these things will solve themselves, over time as you make good drugs. So in the end, I believe that the science and the clinical win. So.
Let's go to we'll do kind of like lightning round questions here. So getting a little bit back to the company and to the science, how did you prioritize therapeutic areas of focus?
That is hard to do. So there's all these threads that come into picking a therapeutic area of interest. There's scientific merit, there's commercial potential, there's development path, how it's going to take you to get there. There's risk factors along the way. So what's the risk profile and the tolerance that you're willing to take for any particular area? So it's a huge multifactorial question. Everybody's got different opinions. We oftentimes sit around at the company and have this very debate. People have a lot of good ideas about potential therapeutic areas to go into, and you need to take all of these kind of pieces into account as you try to make what is, in the end, a strategic decision about that question.
That's great. I wouldn't normally ask this, but I'm going to put you on the spot, but I think you can do this. Can we hear your so we talked about telling the scientific story in a short period of time. Can we hear your 30-second pitch on what your product does?
Okay.
No pressure.
All right, so press the elevator button,
No.
right? That's all right, so at XCUR, we're basically developing three-dimensional forms of DNA or RNA that solve one of the major challenges for therapeutic development of nucleic acids, namely that we get into cells and into tissues, and as a result, we can tackle the underlying fundamental causes of many diseases that are genetically based. So DNA or RNA has a therapeutic basis. underlying a lot of different diseases. Now, we think that we have the therapeutic lock and key mechanism with our technology in order to access those underlying genetic causes. How'd I do? 30 seconds?
Pretty good.
You good?
Pretty good. Folks in the audience are interested in hearing your thoughts on that, again, the transition from science and academia to, they called it industry, but clearly you're at sort of the entrepreneurship side, but clearly a big transition. Looking back on it, are there any, as folks are contemplating that similar type of transition, anything that you would share with them to keep in mind, any roadblocks or any thoughts or advice there?
Yeah, just do it. I mean, there's no magic, moment, I don't think, where you say, like, I can do this, I'm going to be the entrepreneur, and I understand every step it's going to take along the way to be successful. I think it's more about, are you willing to personally take that risk, in terms of what you're going to do professionally, and go for it. So don't feel like you have to know, all the way to the end. In terms of being an entrepreneur. I think it's just more of an attitude about, are you willing to roll up your sleeves and go to work? And if you're willing to do that, then I think that entrepreneurship is right for you. So,
attitude that was born in the lab, which is great. And lastly, if you have any, I'm going to reiterate this question. What do you do in your free time?
Oh, yes, free time. Let's see. I have some planned in 2020. Let's see. I was thinking right now, I used to run a lot of marathons, so Chicago Marathon this weekend. Shout out to anybody who's running the marathon. Great. There we go. So we got some marathon runners over there. I still like to run a lot, so I travel all over the place, and one thing you can do everywhere is run, and that's actually great ways to see cities. So I still do a lot of running. I also love to scuba dive. Have actually over the years become a PADI instructor. Any scuba divers in the audience? All right, good. So I haven't taken that week-long vacation to go to a tropical island and scuba dive in quite some time, but I do often go to Kankakee, Illinois, which is a close second. There's a beautiful quarry there, which I like to spend time in.
I'll take your word for it.
It's a lot closer. But I do enjoy teaching students how to scuba dive as well. So that's fun. I enjoy scuba diving and running. And that's what I do in my free time that I have.
And lastly, just thinking over the next couple years ahead, where would you like to see not only the company, but yourself personally? It's always a difficult question to answer, where are you going to be in 3 years, but where would you like to see yourself in a few years?
Okay, I'm going to retire to
Kankakee,
Illinois. I'm really pushing the Chicago community thing, right? That's part of the area, definitely not that tropical island. So I think the fun part for me, being a scientist, is been translating that really cool napkin sketch idea in the laboratory all the way to today where we're in patients. And for me, a success for Exicure and a success personally is going to be to see when we really helped somebody. Where we've taken that patient that has refractory tumor in oncology and we make the tumor go away. When we take the child that's got spinal muscular atrophy and is currently being injected with the drug that's available 4 times a quarter, and we basically say, here's your one shot, and you're done, we'll see you in 2 years. That'll be a big deal for a 3-year-old, and I can't wait to see that 3-year-old running around rather than laying in a wheelchair. So all of these things for me is kind of the long-term drive and vision for the company. Ultimately, we've got a really cool big platform story. We make a lot of different DNA and RNA therapeutic medicines, and my long-term vision is I want to get that drug and those drugs into as many different places where we can help people as possible. And when we do that, I think that's going to be a huge success story for Exicure, for me personally, and of course for the Chicago biotech community. I'm really excited to be back here in 3 years with a bunch of drugs in the clinic and telling that story about how we got there. So
that's fantastic, and I think what you'll see from David is he's a very authentic leader, which I think is very rare, and I wish you all the best. And we do want you back here in 3 years telling the story. And I know there's a number of people who are looking for you and folks like you for inspiration. So thank you so much for sharing the story, and good luck.
Yeah, thank you very much for having me.
Thank you
for being here.
Thanks, everyone. We'll see you probably. Well, you'll get more announcements about what's going on at Matter and some of the programs that we have here. So thanks for coming. Have a good night.